you guys, which would be bad because I cannot draw. So I just made this little PowerPoint with some simple slides to show you some information about teeth. So can you see it good on the screen? Okay, good. So this presentation is called Dental Health, or only brush the ones you want to keep. That's what we tell people. If you don't want to brush your teeth, fine. Only brush the ones you want to keep. So let's talk a little bit about the function of teeth. And these are pretty obvious. Obviously, you use them to chew is the big thing that people think about, right? Biting into that big hamburger or your apple or whatever. They also give shape to your face. If you'll notice this picture on this slide, it progresses from this lady having a normal profile. And then as the teeth are removed, you can see on the right-hand side that her mouth is kind of collapsed because those front teeth are gone. And so there's nothing to support her lips. And so you've noticed probably if you have grandparents or older relatives and they have their dentures taken out, their mouth just kind of sinks down into nothing because the teeth actually give form to our face, especially the front teeth. And it gives our jaw a stopping place. So when the teeth aren't there, the jaw closes farther than it normally would. And so we get that kind of like shriveled up little mouth look that little old people get when they don't have their teeth. In addition to biting and chewing, our mouth also begins the digestive process. We have enzymes in our saliva that actually start breaking down our food before it even gets to our stomach. And then, of course, speaking and smiling. If you have, again, if you have a relative who doesn't have their teeth in or is missing some front teeth, they talk a little bit funny, right? Or like you see little kids, if they're missing their two front teeth, they kind of have this funny little lisp when they try to say certain sounds. So, and then of course, another big one is, what do people see when we smile? Right? You show your teeth. If you give somebody one that smells like this, where you don't show your teeth, you're probably kind of maybe fake smiling a little bit, right? But when we really genuinely are happy and smile, we show our teeth. And so we want our teeth to look nice and be healthy so that when we smile at people, they're seeing these nice, pretty white teeth when we smile at them. So this is a diagram of primary or baby teeth, okay? And when you're a baby, you have 20 teeth. The United States uses a numbering system where primary or baby teeth are designated with letters instead of numbers. So the primary teeth we designate with letters A through T. And can you see my cursor on the screen? Yes. Okay, so it starts with the upper right. So this would be tooth A, going around to tooth E, tooth F, on around to tooth T. So it goes in a clockwise direction, beginning with the upper right tooth. And so that's how we differentiate baby teeth from adult teeth. So primary teeth are letters A through T, and permanent adult teeth are numbered 1 through 32. And we'll get into that a little bit later. You'll notice here on the side of the screen where it says eruption and shedding. Eruption just means when a tooth comes into the mouth or breaks through the skin. And if you've been around babies, you know it's not quite that dramatic. There's not this eruption. It's this long, slow process with lots of drool and slobbering and gnawing on things and fussing. And, you know, I can remember those days very well when my baby's teeth were erupting. And then shedding just means when the tooth is lost because the grown-up tooth is coming to take its place. And you'll notice here on the dates for eruption and shedding, it doesn't give you an exact date. So the lower incisors here, these little front teeth, are the first that usually come in, and they usually come in between ages 6 and 10 months of age. It doesn't give you an exact date because babies are different. Some babies will start cutting teeth when they're 4 months old. Some babies, it will be later. And these lower front teeth aren't always the first ones to come in. They usually are, but some babies will cut these upper front teeth first. And the same thing with shedding. You're given a general idea over here on the right-hand side of an approximate age that these teeth become wiggly and come out because the grown-up teeth are coming in, but it's different for every kid. And a lot of times kids whose teeth come in late, they'll be lost late too. So that's just kind of a general idea. But usually the lower front teeth on a baby are the first ones that come in. And then they're usually the first ones that are lost. So our next slide, this one's kind of interesting. It's a little bit sciencey and we won't go into all of it. But this shows, and this kind of alien looking thing right here on the left side is actually what the face of a fetus looks like in formation. So when you are forming in your mother's womb, your eyes are kind of over here to the side, and then they move toward the front. Your face kind of forms around this way, and then meshes in the middle, which is really neat. So this shows how a tooth bud forms when you are in vitro, when you're in your mama's belly, and when your grown-up teeth are forming when you're a baby. There's a tooth bud that forms in the second picture. And then you'll notice right here, teeth actually start forming from the top down, which is kind of unusual because you know they have roots. And if you think of a plant or a seed growing, the roots sprout out first, right? And then the plant starts growing up. That's not the way it works with teeth. Teeth are kind of backwards. So they start forming from the top down toward the tip of the root. And so you can see this little bell stage right here. So this is actually the crown or the chewing part of the tooth that starts forming first, and then it forms down toward the tip of the root, and then the tooth erupts. So that's kind of interesting. And here is an actual picture of a tooth bud forming, and you've got some different cells here. These amyloblasts, this layer of cells, amyloblasts are cells that are only present during tooth formation. You don't have them in your mouth now because you're hopefully not forming teeth. Well, you probably are. I'm not. I'm too old. You guys are probably still forming teeth because you are probably, your body is making your wisdom teeth right now, unless you've had them removed already. So you probably do have amyloblasts in your teeth. I am too old. My amyloblast partying days are over with. So the amyloblasts are cells that are only in your body to form teeth. And once your body is done forming teeth, you don't have these cells anymore. And then, so they're forming enamel. That's their sole function, is to lay down the enamel, which is the hard white part of your tooth that shows when you smile. That's your enamel, okay? And enamel is actually the hardest surface in your body. It's even harder than bone. And so these amyloblasts have a really important job, and you want them to do a really good job and give really healthy, strong white enamel. Then down here below that, you see odontoblasts, okay? These cells are responsible for making the layer underneath enamel, which is called dentin, and we'll look at that in a later picture. And so odontoblasts, they actually keep working throughout your life. If you look at a person on an X-ray, maybe in their 70s or 80s, the odontoblasts have continued very slowly over time, laying down more dentin and kind of shrinking the inside of the tooth where the nerve lives. And so a lot of times older people, their teeth aren't as sensitive because those odontoblasts keep shrinking that nerve away from the surface. And I think that's all I was going to say about that slide. Let's move on. So here's a diagram of adult dentition or grown-up teeth, okay? And you can see so from right here, number 3 around to number 4 around to number 13, that's where your baby teeth would have been, okay? These last 3 sets, this set, and this set, come in behind the baby teeth. So when you get tooth number 3 in, your 6-year molar, you don't lose a baby tooth. It just comes in behind your back baby teeth. So these teeth, these last 3 sets of molars, so numbers 1, 2, and 3, and then 14, 15, and 16, and then on the bottom, 17, 18, 19, 30, 31, and 32. These all come in behind the baby teeth, okay? All the rest of these front teeth here, 4 through 13, are baby teeth that you would have that would be replaced by a grown-up version of that tooth, okay? So this set right here, number 3 and number 14, we call them your first molars or your 6-year molars because they generally erupt around age 6. Not always, but in that general area. Then you have another set called the second molars that come in when you're about 12. And then you have another set, your third molars or your wisdom teeth, that come in anywhere usually between 16 and 17, 18. I've seen 15-year-olds that are getting them in. I've also seen 15-year-olds who are just now getting their 12-year molars in. So it's just different with each kid. And third molars are the ones that usually you have removed by an oral surgeon. Have any of you had your wisdom teeth removed? No? No one's didn't? No? Okay. It's usually not that bad, and they usually put you to sleep for it. I had mine removed on my 19th birthday. Thanks, Mom and Dad. So you just go, they put you to sleep, you wake up and it's over with. And it's generally not that horrible. The reason we take these teeth out when you're a younger person is because as you get older, the bone of your jaws gets denser and harder. You also don't heal as quickly. So if you have to have one of these teeth taken out when you're 45 or 50, as opposed to when you're 16, it's a lot harder to get the tooth out, and then it's a slower healing process. And we'll talk a little bit later about why we take these teeth out to begin with. Okay, so here is a diagram. On the left, we have a child with what we call mixed dentition, or grown-up and baby teeth. And then on the right, you have an adult dentition. And like we said before, teeth form from the top down. But as adult teeth form and move toward the surface, the roots of the primary teeth start to resorb or dissolve away. That's why the tooth gets loose. And so you can see, like right here, this permanent tooth, even though it's just forming, it's already pushing up against the roots of this primary molar, and these roots are going to start dissolving. So when you pull a baby teeth, this part right here is all that comes out. Okay. So the roots resorb away, the tooth gets loose, and then it falls out. And occasionally you'll see an adult who still has a baby tooth in their mouth. And the reason was, for whatever reason, let's say your body does not make this permanent tooth. It's just, there's no tooth bud, your body doesn't make a tooth. Then the roots of the primary tooth won't dissolve away, and you'll just keep it. And so I've seen people in their 30s and 40s that still have a baby tooth or two in their mouth. And a lot of times it's hereditary. So if your mom is missing a permanent tooth, a mom or dad, then a lot of times one of the kids will be missing a permanent tooth. Sometimes the same tooth, sometimes a different one, but it does tend to be hereditary. And so that's kind of neat just to see. And we have an X-ray later in the presentation that shows, oh, there it is right there. This is what we call mixed dentition. So you can see we've got these baby teeth, and then up above them, up in the jaw, we've got the grown-up teeth that are starting to form. And you can see how the root of these teeth is not formed yet. They're just, the top is formed. And sometimes even on young kids, if you look back here, you can see where the third molar is going to be forming, but I don't see that on this X-ray. So this person may not have third molars, and occasionally that happens. That some people just don't have them. Some people have extra. Some people will have, a guy I went to church with had 6 third molars. He had 2 on the bottom, and then he had 4 on top. So sometimes that just happens. We take these X-rays. We start taking an X-ray like this when a kid is about 5 or 6 years old. And the reason we do that is because we can look on here and see if any of the permanent teeth are missing, and kind of plan in the future. Oh, we're going to need to send this kid to the orthodontist so they can make sure and close that space up, or we're going to need to plan for different things down the road because they're missing, you know, what if they're missing their 2 front teeth on the bottom? We kind of need to know that ahead of time so we can get something planned for them as they grow. And X-rays like this also check for tumors and cysts that are sometimes located in the jawbone. So this is called a panoramic X-ray. All right, next we just have a plain old diagram of a tooth. And you've probably seen this since you were a kid. We've got the outside layer, the enamel, and the inside layer, which is the dentin, and then the pulp, which is where the nerves of your teeth live. And you can see out through the tip of the root, the nerves are connected to a nerve canal that innervates the tooth. Okay. You've also got bone around your teeth. The bone that holds your teeth in is different from the bone in the rest of your body. It's called alveolar bone, and it's only found in your mouth. And we'll talk a little bit more about that later. Okay. Houston, we have a problem. So now we're just going to talk about some of the problems that people can have with their teeth and how to correct them if they're correctable. One problem we're going to talk about, this is called decalcification. So you can see on this tooth, I can't even see my own screen because the sun's so bad. You can see on these teeth the real whitish lesions. See how it's real white? And I would just about bet money that this person had braces, because you can see where the brackets were glued on, can't you? See that little area where the bracket was glued on? So we see this a lot with kids. They'll have braces on, and if they don't do a very good job cleaning them, then the place where the bracket was glued on stays clean because of that cement. But then all around it, where plaque just sits on that tooth all the time, it basically sucks the minerals out of the enamel. And we call it demineralization and decalcification. So all the enamel around where the bracket was is decalcified or weakened. It's not a cavity, but these areas like this are more prone to get a cavity. If you take a dental instrument and rub it across, like a sharp instrument, and rub across it, Healthy enamel feels glassy, it's real smooth, but decalcified enamel can start to feel rough and pitted. And if it's rough and pitted, it's going to hold on to plaque easier, and it's going to be easier to get cavities in these areas. I had a patient a few years ago, and every time she came to get her teeth cleaned, we would tell her and her parents, she's got to brush better, she's got to brush better. And she came back in when the braces were off and her teeth were nice and straight, and she had circles like this on every one of her front teeth. And her mother was like, what can we do? You know, and at that point, you're looking at cosmetic procedures that are pretty expensive to to make the teeth look better cosmetically, because you can't just, we don't have anything magic we can just scrub that off with. It's actually damaged enamel. If decalcification persists, it can become actual tooth decay, which is a cavity. And I'd say, I guess most of us have probably experienced the joy of having a cavity and having to have it repaired. I had a lot of them when I was a kid because I had to take medication for a heart condition. And so it weakened my baby teeth. So I was at the dentist all the time. I think that's why I ended up working there. I thought, hey, if I'm going to be here all the time, I might as well get paid. I'll just go be a dental hygienist. So there you go. So what causes tooth decay? We kind of know that already. It's from not brushing and keeping the teeth clean, but it's actually an infection with certain bacteria that are in your mouth. And we all have bacteria in our mouth, and we all need bacteria in our mouth because they do things like breaking down food and things like that. But if the bad bacteria get to a certain level, they can start causing damage. One of the main culprits for tooth decay is a bacteria called strep mutans. So if you have a cavity, you have an infection of strep mutans in your tooth. This shows the stages of caries or cavity development. I don't really love this diagram, but it's the best one I can find, because cavities, it shows the cavity kind of starting up on the tip corner of a tooth. And we do see those class 5 cavities occasionally, but usually in a molar, they're going to start right here in the middle, down in the pits and grooves of the tooth. But anyway, so this shows a cavity. This is just a small cavity that's in the enamel, right? Then we show it getting a little bit deeper. Okay, a cavity like this on the left, this enamel caries, you won't feel. Your tooth might get a little sensitive, but probably not. And then once it gets through into the dentin, which is softer, it will grow a lot faster. And that's why we encourage people to have checkups once or twice a year, because a cavity that gets through the enamel can just mushroom really quickly and become a big problem. Whereas this one over here, we can do a simple filling and you're done. Once a cavity gets through into the nerve space of the tooth, which is right here, this is when you start having really bad pain. The tooth gets sensitive when you bite, or to hot and cold and things like that, and it starts to affect your ability to eat. And then you get over here to this last picture, and the infection actually gets into the nerve. It will travel down the root of the tooth, and infection will actually build up at the end of your root and cause damage to the bone even that's holding your tooth in. This is very painful. I've never experienced this, but I have literally seen big, tough grown men cry with a abscessed tooth. It's very painful, and you can take all the Tylenol and the Advil, and it usually doesn't take care of the pain because of that infection. This next slide. So here's a dental X-ray of cavities. So on this left side here, you can see cavities. This one right here looks like it's through the enamel, but this is not very bad. This one's worse. You can see this shadowed area goes pretty deep into the dentin, but still neither one of these would be super, super severe. They would definitely need to be fixed. And then over here on this molar, you can see the decay has just taken a big bite out of this tooth. And then you can see all down here, all this dark area is infection that's come out of the end of that tooth and has nowhere to go. And so it's just built up in the jawbone and made an area of bone that's kind of been destroyed. Now this bone, once this infection is removed, it will fill back in. It will heal itself. So for a tooth like this, you're probably looking at a tooth that would just have to be removed. It's possible you could save that tooth, but it would be very expensive and take a lot of different procedures. You would have to do a root canal, probably remove some of the gum tissue. You're looking at easily, I'd say $2,500, probably more, to save that one tooth if it's savable. So that's why we encourage people to have dental checkups regularly, because a filling like this might cost you depending on where you live, around $200, $230, $250 to fill this tooth and keep it. Whereas if you let it go another year, another 2 years, you're looking at a situation like this where the tooth is probably not repairable. And if it is, it's very, very expensive. Dental work is very expensive. It's a lot cheaper to buy toothpaste and floss and use them. Okay. Some more dental problems. Okay, these are kind of ugly pictures, but this is the things we get to see when we work on people's mouth. This upper left picture we call Mountain Dew mouth. And I have to make a confession, children. I love Mountain Dew. I really do. But I really limit myself because it's like drinking battery acid. It's really hard on your teeth. So when we see people come into our office and all at the gum line, they have all these cavities, that's usually the first thing me or the doctor will ask them is, do you drink Mountain Dew or Dr. Enough? And 9 times out of 10, they say yes. I had a young man in my chair about 6 months ago. He was in his early 20s. He had a cavity on every single tooth in his head. Every single tooth. And his canines right here, this tooth right here, the enamel was gone. He just had enamel on the very tip of this tooth. It was gone. All the enamel was gone. And so he had thousands of dollars worth of work that needed to be done. And I asked him, I said, do you drink Mountain Dew? And he said, yep. And I said, do you sip on it all day? And he said, yep. So he would buy the big 20 ounce with the screw top lid and just, you know, take a drink, put the lid back on. Is anybody guilty of this? Anybody do this? I've been guilty before. But people that do that, people that work, you know, men that work out and have jobs or women, they'll take those big 20 ounce drinks, 24 ounce drinks with them and take the lid off, take a little drink, put it back in the cooler. A few minutes later, take another drink. They're constantly putting acid on their teeth. Even though soft drinks taste really sweet, they're really acidic on your teeth. And so this is what you get, is this decay at the gum line. We call it Mountain Dew mouth, which looks really similar to the picture below it, which is damage from meth use. It looks really similar. Obviously, there's a big difference between drinking Mountain Dew and using meth. I'm not equating the two, but the damage that it does to your teeth is really similar. So, so here's damage from meth use. And people with meth use, I went to a educational course one day and a man was telling us, he worked with meth addicts, and he said when they're coming down off a meth high, they just have hallucinations, and they that's why a lot of people that use meth have like sores, because they'll pick at their skin. But he said he had talked to one person who used meth, and they said when they were coming down off meth, they'll clench their teeth really hard. And they said sometimes they would go get rocks from the parking lot of their apartment and bite on them because they had so much tension. You know, a lot of people, when they get stressed, you'll find yourself kind of clenching your teeth, but they would have so much stress and so much tension from coming down off that meth high that they would go actually get rocks and bite on them. And I told you earlier that enamel is the hardest surface in your body, but look at this enamel. This enamel is not healthy. Excuse me. So enamel that's not healthy can break. And obviously, even with healthy enamel, if you clomp down on a rock, you can break your teeth. So people with meth, additionally, obviously, if you're on a meth high for 5 or 6 days, you're probably not brushing your teeth. You're probably not flossing your teeth. If you do eat, you're probably eating just junk or whatever. I don't know. So their oral health care, you know, their oral hygiene is not a priority because they're, you know, high on drugs. So that's a really sad effect of methamphetamine use, is really, really bad damage to your teeth. Over on the other side of the screen, these are just cavities that people can get. This just shows how much damage that cavities and those bacteria can do to your teeth if you're not taking good care of them. The good news is this is easily prevented. Most oral problems are pretty easily prevented. This next picture is a couple of problems that we can see in young children sometimes. This one here is we call bottle rot. Okay, and this is what happens when you are putting a child to bed or down for a nap consistently and giving them a bottle of milk or formula or juice. Juice is the worst, and letting them lay down and drink that juice or that milk and then not cleaning their teeth. Because when babies' teeth start coming in, that's when you have to start cleaning them for them, right? They're not going to brush their teeth, but you have the little brushes you can use. And so we call this bottle rot. And so it's a pretty significant problem. Excuse me. This other picture here is called an open bite. So this is from a kid who's been sucking their thumb a lot. And you can see when their back teeth are close together, their front teeth don't meet. So this kid is biting down in the back, but their front teeth are not meeting because they've had that thumb in there so long. So their mouth has actually grown to accommodate having that thumb in their mouth all the time. And so we see that with kids that either suck their thumb, suck their finger, or something like that. This is correctable with orthodontics, but you know, obviously, if you can break your kid from sucking their thumb, you might save yourself some money with the orthodontist. So, all right, this next picture. Okay, gingivitis. This upper left picture with the little arrows on it is something I see in kids your age a whole lot, middle school and high school kids, unfortunately. Part of it is because your body's changing, your hormones are kind of crazy. So when your hormones are kind of crazy, your gums can be a little more tender. We see that in pregnant women also. Pregnant women tend to get gingivitis even if normally they don't, because their hormones, you know, they're growing a human, so their hormones are kind of crazy. So this is gingivitis. Gingivitis is caused by bacterial plaque that gets on your teeth that is not removed, okay? And your gum tissues don't like that. They get real irritated and red. Gingivitis, though, is reversible within 7 to 14 days. It's really easy to fix. So if you look in the mirror and you think, man, I've not been brushing good this week because I've been busy studying and playing ball and my gums are all red, don't panic. Just start brushing and flossing, you know, brush 2 to 3 times a day, floss, it'll go away, okay? The problem that happens is when it doesn't go away, and when it's chronic. You have chronic gingivitis and you just let it go and let it go and let it go. Then your teeth can go from looking like the teeth on the top to looking like the teeth on the bottom. This is not the same person's mouth, but this bottom picture is been progressed to periodontal disease, which is not real attractive. The way it happens is on this left diagram, you see healthy gums, okay? They're nice and pink. Then you get the plaque forming on your teeth. Let's say you go to the dentist and you get your teeth polished by the hygienist and they feel amazing. And you think, oh, my teeth are gonna be clean forever. But actually within about 12 hours, that bacterial plaque will start forming a layer of film on your teeth called the acquired pellicle, which is just this matrix of stuff it lays down on your enamel, and then it'll start growing bacteria. So within 12 hours of having your teeth cleaned or brushing really well, that stuff starts growing back on your teeth, which is why we say brush your teeth 2 to 3 times a day, because in 12 hours, they're going to start feeling dirty again. If you do not brush your teeth and you do not remove the plaque every 12 hours, it will start to build up thicker and thicker, and it will start to harden into hardened deposits, which we call calculus. So yes, you can grow math in your mouth. Who knew, right? Most people call it tartar. You'll hear it called tartar, but the big fancy dental word is calculus. So you can form calculus on your teeth, which is hard and which you can't remove with your toothbrush. We'll talk a little bit more about that later, and I have a nice gross picture of some for you. I know you're looking forward to that. What happens is the way you get from this top picture to this bottom picture is those deposits of plaque start building up above the gum line. And if they're not removed, guess where they start going? They start creeping down below the gum line, down here to where your toothbrush can't get to. And so once they do that, they start causing all this irritation down underneath the gum line and of this bone around your teeth. And so the bone, that alveolar bone, that special bone that's only in your mouth, if it gets all that bacteria down in there and all that infection, after a while it's like, hey, fine, I'm out of here. I'm sick of this, I'm leaving. And the bone around your teeth will actually start to dissolve away. And I've got an X-ray of that pretty soon. The bad part is once that bone is like, okay, I'm out of here, bye. Well, let's say all of a sudden you're like, wow, I got to take care of my teeth. And you go to the dentist and you have all those deposits removed and you start brushing and flossing and you're the best little dental person in the world, that bone is not going to come back. It will not grow back up the tooth. Okay, so once it's gone, which is pretty serious. So here is an X-ray of bone loss. So this picture shows normal bone. Okay, it should be right up around the crown of the tooth, and over here where the bone should be up here, it's dropped all the way down here. Okay. And like I said, even if you go get treatment, you start brushing, you start flossing, that bone is not going to grow back up. This tooth right here, I would be able, if this was a real person and that I had in my dental chair, I would be able to take my finger and rock that tooth back and forth. It would be loose. Okay. The #1 cause of tooth loss in adults in the US is not from cavities, it's from periodontal disease, because there's nothing to hold that tooth in, and eventually it can be lost. Okay, there are ways to stabilize teeth that have a lot of bone loss, but it also a lot of times people lose them. And have a kind of a funny story about that. I had a new patient one day in my dental chair, and I was going to take X-rays on her. So I asked her, I said, do you have anything removable, like, you know, a partial or a tongue ring or whatever, anything that comes out of your mouth before I take X-rays? And she said, yep, I have a partial, and they have metal on them, so we took it out. And she said, I have a crown that keeps coming off. She had an artificial crown placed on her tooth. And she said, it keeps coming off, but I just put it back on. Do you want me to take it out? And I said, yeah, take it out so I can take an X-ray. And so I went out of the room to get my film, and I came back in and I looked down, and there on the tray was her partial, and there was a crown, like a metal and porcelain crown. And then it had the whole roots. It was a whole tooth laying there on the tray. Like it was one of these premolars. It was the whole tooth, and it was sparkling clean laying there. So I looked at it and I looked at her, and I thought, well, I'm just going to have to ask the obvious question. I said, ma'am, does your tooth comes out? She said, yeah, it was real loose and it came out a while ago, but I don't want to lose it. So I just brush it and put it back in. And so when I looked in her mouth, there's this perfect tooth socket, this hole where she would, when she brushed her teeth, she would take that one out and brush it and put it back in. It was the craziest thing. And I told her, I said, well, I'm just going to tell you, the dentist is probably going to recommend that you don't do that. But before she left, she popped it right back in and left. She did eventually have a permanent replacement made. And when I took her X-ray, that whole area, the bone was just gone. It was just gone. So if your tooth falls out, just let it go. Let it go. Okay. So periodontal disease is a common and largely preventable problem. The thing with bone loss like this is it's usually painless. But people will notice that their gums bleed really bad when they brush or when they floss, or sometimes if you just touch them, they'll just bleed really easily. And they'll often be really red and swollen. A lot of times people with periodontal disease, their breath is not pleasant because of all that bacteria in their mouth. And so the way we check for gum disease when you come to the dentist is with the X-rays, like here, where we can see your bone levels. And then we have something called a periodontal probe, which is this metal instrument you see right here. These are really thin. You can see the marks on it. So what we do is we slide this probe in between your tooth and your gum. We don't push it hard. It shouldn't be painful. And we measure how far it goes down in between your tooth and your gum. So a normal healthy gum, the probe should go between 1 to 3 millimeters, which millimeters are super, super tiny. It should go down between 1 and 3 millimeters. Okay. On this side over here, you can see there's that tartar buildup and there's the inflammation, and you can see right here how the bone has kind of gone away. And so it allows that probe to go farther down under the gum line. So we start getting numbers like 5s and 6s and 7s, and that's how we know that there's a problem. The way we treat this is we use our instruments, our dental instruments, and scale off those deposits. Usually for someone with deep pockets like this, we would have to give anesthesia first because it would be really uncomfortable if your gums weren't numb. And so we'll have the dentist administer anesthesia, and then we'll take our instruments and scale below the gum line there to remove that. And in more severe cases, we'll give, sometimes they'll give oral antibiotics, and sometimes we have to send people to a specialist who will actually take a scalpel and kind of cut the tissue back from the teeth and lay it flat down so he can actually see in there, and then he'll scale everything and then stitch your gums back up on the side of your teeth. So that's a much more involved, much more expensive procedure. So let's look at, so here's the nice picture I told you I would show you. And all this right here is calculus, or what you call tartar. It's kind of this yellowish color. It's right here, all around the edges of this tooth right here. I've seen people where it's all grown into one big solid piece, like it's the teeth are all connected. It's just like one big piece. I've seen it where it's grown down almost to the floor of the mouth, where it's been in there so long without being removed. And then on this X-ray, you can see right here, see these little spikes that are sticking out from the side of the teeth. That's actually deposits of tartar that have gotten so thick that they actually show up on the X-ray. And so you have to take these metal instruments and get between there and remove those. And this stuff can feel like cement. It can get really, really hard. And if it gets down below the gum line, it's actually black. So you kind of get in there and have to clean this black stuff out from around the roots of the teeth. And for that, we use this instrument right here, which is called an ultrasonic scaler. I call it my Dremel tool or my power tool. When people come in, I say, okay, I'm going to have to get the power tool out for you. But this uses vibration, and then it has water to cool it so that it won't get hot. And so that will take that off a lot easier. All right. So here is an X-ray, a panoramic X-ray with some wisdom on it. So these are the ones we talked about that you usually have removed when you're 16, 17, early 20s. The reason we have them removed a lot of times is most people, especially women, don't have room for them to erupt or to come in all the way like they should. Okay. Like I didn't have room at all. Another reason is, see how this one's tipped over, like he just fell over and can't get up. Okay. The thing with teeth is when they start forming, teeth can't turn. Okay. They can't be like, oh, I'm going the wrong way. Make it left, make it left. They don't do that. Whatever way they're facing when they start to form, that's the way they're going. So this guy here, this is the only direction he can go is this way. Okay. And obviously there's no room there. And so, you know, with other teeth, we have braces and things we can do to, you know, turn them the right direction. But with these, there's nowhere to go for this guy. And sometimes if the tip here is sticking out of the gum, then you have a little bit of the tooth exposed. Do you think that's easy to clean when you just have a tiny corner of your tooth sticking up through the gum? It's not. It's really not easy to clean. And so bacteria can get down in here. You can get infections. You can also get a cavity back on the back side of this second molar here, which, as you can imagine, for the dentist is almost impossible to get to fix it. So a lot of times it's easier to just take these 4 out, and then you don't have to worry about them damaging the one in front of them. And so that's one reason that most of the time third molars are removed. Okay. All right, another problem in the oral cavity can be an oral cancer. And there's a picture right here of an oral cancer. This is kind of up on the roof of the mouth. Oral cancers are generally painless, and they can be anywhere in the mouth. They can be in the side of the cheek, on the tongue, under the tongue, pretty much anywhere. And like most cancers, there are things you can do that dramatically increase your risk of getting an oral cancer, and that is using tobacco. It doesn't matter if you're smoking it, chewing it, dipping it, putting it in your cheek. You're putting a carcinogen in your mouth, and so it dramatically increases your risk of developing oral cancer. People who smoke pipes have a higher risk of getting cancer in their lips, and people who dip skull or chew tobacco can get cancer inside their cheeks and gums. And if you know someone who dips skull, you can look down inside their mouth where they put that, and you can see a change pretty easily. It'll be, their tissue will be kind of like when you get in the bathtub and you stay for a long time because it feels really good and you're lazy and your fingers get kind of shriveled up and white. That's what their cheek tissue looks like where that tobacco sits. It gets kind of shriveled up. We say the correct term in dentistry is corrugated. Their tissue is corrugated and it gets this whitish film on it. So you see that in people that dip skull and things. It doesn't always develop into oral cancer, but it increases your risk. And I know the doctor that used to own the practice where I work, he found an oral cancer on a lady a few years back, and she wasn't a smoker. He just found a cancer in the roof of her mouth, and she ended up having to go and have a major surgery. And then I think just the last year or two, it actually came back and she had to go have another surgery again. So it's real important when you go to the dentist that they'll look all around your mouth, even if you're young, even if you're not a smoker, just to inspect areas. And if you ever have a sore in your mouth or a place that doesn't hurt but won't ever go away, you need to have it checked. Another high risk factor for oral cancer is heavy drinking. A lot of times people who have oral cancers are heavy drinkers. So that heavy use of alcohol can also increase that. Here's another problem that we not often, but more commonly see in the oral cavity, and that's a cleft lip or a cleft palate. And so you can see this little sweetie right here. He's got a little cleft lip. And you can see this picture below shows, and this kind of looks like, is that an alien? It's a baby though, that's what we look like. And you can see how when the face starts forming, the eyes are kind of more to the side, and then the face kind of comes together and fuses. And so what happens in a cleft lip or a cleft palate is, for some reason, like if you look at this picture right here, you can see that little cleft right there. For people that are born with cleft lips and cleft palates, for some reason, when their face forms, that tissue just does not fuse all the way, and it just leaves an opening, okay? So there's a cleft lip. That's just when the opening is just in the lip. And then this other picture you can see, this is a cleft palate. And this is a lot more serious, especially in little babies, because how do babies drink? Right? They suck. This kid is not going to be eating anything solid yet. So he needs to suck, okay? And in order to suck on, whether he's breastfeeding or eating a bottle, you have to form suction with your mouth. So if your mouth, if you have that opening there and the opening in the roof of your mouth, you can't form suction. And when this baby would try to drink, the milk or the formula would go, up into his nasal cavity. And so for young children like this, until they can have surgery to correct it, they have something they make called an obturator, which is something that's placed up in the roof of the mouth to seal that opening off. And it's kind of like a retainer, but it just covers that hole. And so some people have to use those. And cleft lips are actually more common than a lot of other dental abnormalities. I can think of probably 3 or 4 people I know right now off the top of my head that have had a cleft lip and had it repaired. And it's actually pretty easy to repair. They can do a really good job with these now. But that is something that we occasionally see in babies, is a cleft lip or a cleft palate. Okay, this is not so much a dental problem as a really cool solution to a missing tooth, okay? So yes, this is exactly what it looks like. That is basically a screw that is screwed up into your jawbone, okay? This is a dental implant, okay? So let's say something happens and you have to have a tooth removed, or you get one knocked out, okay? My best friend in dental hygiene school had beautiful, beautiful teeth. And this one right here, right beside her front tooth. We had gone home for the weekend. We came back to college and she said, look at my tooth. It looks funny. And this tooth right here was like a pinkish gray color. And I said, let's go take an X-ray. So we take an X-ray and it looked like someone had taken a hole punch through the root of her tooth. It was just a big circle, which is something that happens called internal resorption. It's just this phenomenon that happens occasionally. It's very rare, don't get worried. So that her front tooth right beside her big tooth had to be pulled. She was getting ready to get married. It was this huge, huge deal. So she had an implant placed. The dentist at the dental hygiene school where we were going to school put some material over the tooth to cover up that ugly color until she could get through her wedding. And then once she saved up the money, she had the tooth extracted and had an implant placed. And so an implant is sometimes if you have a tooth removed and there's, the tooth has just been removed, they'll go ahead and screw the screw right into the socket where your tooth was, where your natural tooth root was. But if it's been a while, and let's say this tooth has been missing for a long time, they'll take a drill and drill a hole into your bone. You're numb for this. And then they'll put this titanium screw into your jawbone and then stitch the gums back over it and leave it for about 3 to 4, sometimes 5 months. So the bone can grow around it and get a really good hold on those threads of the screw. And then after it's solid in there, they'll go back and uncover it. And you can see right here, they have this post they put in, and then the dentist can make a crown to go on the top of it. It's a really cool high-tech way to replace missing teeth. Of course, as new technology goes, it's also the most expensive. So you're looking at about $3,500 right there, probably, for that tooth to be replaced. Interesting. Okay, so let's get to the good part, which is how do I keep all these bad things from happening in my mouth? You already know the answer. You've been told this since you were like 4 at the dentist. Brushing your teeth 2 to 3 times a day, flossing your teeth every day, and additionally, sometimes using a good fluoride rinse like Act Fluoride. When you brush your teeth, you should be brushing your teeth for about 2 minutes. A lot of us in the morning when we're in a hurry spend about 30 seconds. So try to make sure that you're taking the time to cover all the surfaces of your teeth with a good toothpaste that has fluoride in it. Okay. You also want to make this little diagram here shows how you want to angle your toothbrush. And when you're brushing your teeth, even though you want to get them good and clean, don't do this number right here, where you're just scrub super hard, because that can actually damage your enamel over time. Flossing, of course, nobody's favorite activity, even mine, but it's very important because even if you brush super, super good 2-3 times a day, your toothbrush can't get right here in between these teeth. So you're leaving those two sides of your teeth that touch dirty with bacteria in there, okay? So flossing is really important. Another important aspect of dental health is your diet, okay? Sugary foods feed the bacteria that are in our mouth, okay? And when the bacteria get lots of sugar to eat, they reproduce, they make families. And when they reproduce, guess what they give off? They give off acid, which contributes to the breakdown of your enamel. And you need to be kind of careful because it's not just candies and cake and cookies that are bad for your teeth. A lot of starchy snacks like potato chips and crackers, when our body breaks that down, it breaks it down into sugar. And first we talked about Mountain Dew. Soft drinks are very, very acidic on your enamel. Even though they don't taste sour or acidic, they are, especially Mountain Dew and Dr. Enough. They're just the worst. So they can do a lot of damage. Another thing you can do is the fluoride rinse. I use this one right here, even for my kids, use the Act fluoride rinse. And then you've probably had these little trays put in your mouth at the dentist before. This is just concentrated fluoride, and it helps those weakened of your enamel. It's kind of like vitamins for your teeth. It'll help remineralize the enamel and make it stronger to resist decay. Scientists and researchers discovered in the 1940s that there was a correlation between high fluoride that was naturally occurring in water instances and the rates of dental decay. They started noticing, hey, these people that live in these areas that have a lot of fluoride in the water have a lot less dental decay than people who live in other places with no fluoride in the water. And so in the 1945, Grand Rapids, Michigan was the same, started adding fluoride to their public water. And we're talking minuscule amounts. It's 0.7 milligrams of fluoride per liter. So that's one thing they've done, because back in World War I, the biggest reasons for men to be rejected for the draft was for poor dental health, because you can't send someone out into battle to the front to be out gone for weeks and weeks when they've got teeth that are, abscessing and they're in horrible pain. And so since we started fluoride to the water and using fluoride on teeth, the rate of decay has gone down a whole lot. And so that's another good treatment for dental decay is fluoride. So that is the end of my slideshow. So I will turn things over to Miss Jillian. Does anybody have any questions? I will be glad to try to answer them if you have any. But if not, I'll turn it back over to Miss Jillian.
So I have a question.
Okay.
What do you say to people that feel like fluoride is unhealthy? Or like, I know I've had people recently be like talking about fluoride in the water and not wanting fluoride in the water. How do you respond?
We have, well, obviously if someone, we don't do fluoride treatments for adults, we just do it for children. So obviously if someone comes in and we'll ask them, is it okay if your child has a fluoride treatment? If they say no, some people believe fluoridation in the water causes cancer, or that fluoride treatments, that fluoride in the body is bad for you and can cause cancer and things like that. And too much fluoride actually can damage your teeth. It's like anything, too much of a good thing, anything, too much water can kill you, right? So there are such things. There are places in the world where the water out of the ground, the natural water, has to be defluoridated. It has to have fluoride removed because it has too much and would damage people's teeth and bones. The CDC's research has not found any correlation between fluoride in drinking water and incidences of cancer. So that's all I can tell people. And obviously, if you bring your child in and you don't want them to have fluoride, we're not going to make them have fluoride. But I do know that pediatricians, if you live in an area like a rural area and you have spring water or well water, a lot of times the pediatricians will recommend fluoride drops to put in your baby's drinking water. So, I've not seen any research, and I was not taught in dental hygiene school that there was any correlation between fluoride and cancer or harm. So that's all I can tell people. And then again, of course, it's up to them whether or not they want their kid to have fluoride.
Thank you.
You're welcome.
And what other questions do y'all have for Miss Rebekah?
No questions. Who's going to floss really good tonight? Raise your hand. Come on. Yes, yes, I've done my job. You all have beautiful teeth, so.
All right, can we tell Miss Rebekah thank you?
Thanks, guys. Hope y'all have a great day.
All right. So that is all that I have for you all today, too. So this is our last class of the semester. Sad times. So go ahead and make sure you get your homework in today. Make sure you do your parenting report if you haven't done that. And I'll be sending out grades in the next couple days. But y'all have graduated from health class. You survived a whole semester. Super proud of y'all. I hope it's been helpful and y'all have learned something and have taken some things away from this class that will go with you throughout your lives. So it was awesome getting to know y'all and be your teacher and survive this weird Zoom thing that we're navigating right now and all of that. So, all right. Anybody have anything else? Okay, well, y'all have a good day and I'll see you soon. Bye.